In this module, I'm going to dive into recovery at home. And this is just a high-level overview, but the basics are really the cornerstone of your recovery process. The important things to note are that you need to move every couple of hours, just like in the hospital when the nurses got you up and moved you around. It's because a variety of physiologic processes happen when you go from a lying position to seated to standing. It helps circulate blood, helps improve airflow in the lungs, and help the lungs expand deeper, and it's just very beneficial to regain your stamina and your strength. It's important to use your chest pillow or your heart pillow, whatever you call it, and to cough every 1 hour while you're awake. The point is that it clears secretions, it helps prevent pneumonia, which is something that would land you back in the hospital, and it just keeps your airway clear. It also gets you used to accepting some of the discomfort that goes along with coughing. I'm sure you remember that in the hospital as well. If you get a tiny bit of blood with a cough, that's probably okay, but if you're getting blood clots or you're feeling short of breath, that's not. Call your doctor immediately or seek care. You use a device in the hospital called the incentive and you need to continue this at least for several weeks when you're home. Take deep breaths, inhale and exhale forcefully, follow the instructions as you were taught, and this again is to improve your lung volumes and to prevent you from getting pneumonia and to get rid of some of that what's called atelectasis, where the lungs will collapse and settle on themselves. It's important to arrange cardiac rehab. Usually this will start within 1 to 2 weeks of arriving home, usually around week 2. And if it hasn't been set up already, just take charge, call your doctor, and get that set up. It's an important part of recovery, particularly after open heart surgery, valve surgery, and anything that's in the chest, essentially, dealing with the heart. Take your weight every day before breakfast. Use a consistent time. That way you'll minimize fluctuations and fluid shifts that occur during the day from sweating, exercise, and drinking. You really shouldn't gain more than a couple pounds a week. If you're gaining more than 5 pounds a week, this can signify a problem and it deserves paying attention to and discussing further with your doctor. The overall goal is to limit fluid intake to around 2 liters a day. It's not a hard and fast rule. Depends on if a person has any heart failure, but 2 liters is a general ballpark that's written throughout the literature. It's important to monitor the legs for swelling. Swelling is a sign of fluid retention, could be a sign of developing heart failure or potentially a valve problem, or all the above. Kidney problems also play a role in this, so if your legs are getting puffy and swollen, definitely needs to be discussed. If just one leg swells up and is painful, that is a serious sign that should be taken, should prompt you to take immediate action. That can be a sign of a blood clot, and it needs to be figured out quickly. So emergency department, ultrasound, talking with your family doctor or nurse promptly is really the key there. It's important to manage your thirst with ice chips, popsicles, or mints. This is one way to kind of minimize overdoing it with fluid intake, at least in the initial post-op recovery phase at home. So this is just a few tips, things that you probably had heard, but maybe you had forgotten, just to jog your memory and to lay the foundation for recovering at home.